What do people really need to know about the side effects of Muse cells? Maybe you could talk about the more common things that happen and maybe the rare but serious things people should know about.
Right. So overall, I'll start by saying these therapies are traditionally extremely safe. There's been a good amount of research into safety, if anything. If people have heard scary things about stem cells, a lot of the time these things are coming from research studies where people are tampering with cells or trying to do cellular reprogramming in a lab, but they're not necessarily things happening in real time. For me, what I see a little bit more of is people toting stem cells as a cure-all or using them for indications that I think are a little less than ideal. Things we typically see with a patient, a lot of the time patients come in, they get either a precise injection at some sort of site or they're getting an IV infusion. For the most part, what you can expect is maybe a little bit of an inflammatory response. I find that this can have to do with how much inflammation the patient has. So if a patient's dealing with a low inflammatory burden throughout their entire body, typically it's very mild, any sort of response that does happen, and we just watch and wait to see if there's healing at whatever site we're trying to treat. If a patient's coming in and they're very inflamed, for example, sometimes we get patients with autoimmune conditions or things like Lyme disease, or they have systemic inflammation just because their body's not well cared for. And when you put a strong healing modality like a mesenchymal stem cell in general or Muse cells, sometimes what you see is even more of a flare. And this can scare some people a little bit. This is a bit natural because if you can imagine, these cells are trying to treat inflammation. You put them into an inflammatory environment and everything goes on overdrive to try to fix a little bit. Sometimes the body heals after that. Sometimes we see mixed results in between, but that's certainly... As far as contraindications are things that we should really avoid. People that are like very sick, we're cautious and we do a lot of screening. But overall, I would say there's no hard contraindications in the world of stem cells or regenerative medicine for especially Muse cells at this point in time.
Now, part of the reason why we're talking now is there's actually been a lot of changes in state regulation around stem cells, actually.